Dr. Rosenthal also serves as a senior physician in Britain and the Women's Hospital, Beth Israel DeCourses Hospital, and the Dana-Farber Cancer Institute, Boston, Massachusetts. He's a Henry K. Oliver Professor of Hygiene at Harvard University. Now, welcome Dr. David Rosenthal to have a speech to us.
Thank you very much. And again, as I said before, it's a pleasure to be here at the International Society of Integrative Oncology in Shanghai. And it's been a real eye-opener for me to see what is going on with the cancer field here in Shanghai and in China as well. And I've learned several things already. This morning, I would like to discuss the major issues in addressing the cancer problem. Eliminating cancer is a major health issue, as cancer knows no boundaries, and this mission extends worldwide. Better prevention, early detection, and advances in therapy have helped some countries to lower the incidence and mortality. But in many parts of the world, cancer is a growing problem. In 2007, worldwide, there were 12 million cases of cancer, with 7.6 million deaths in 2007. In the United States, we claim, unfortunately, 1.4 million of those 12 million, with 560,000 deaths. What I'd like to do is, as far as trying to understand many of the issues, I think it's very important to look at cancer statistics. And what I'll try to do is to show trends in the cancer incidence, cancer mortality in the United States, and then show some of the international statistics that are available, and then some word of mouth I did receive here in Shanghai as well with respect to some interesting changes. We'll then talk about what are the risks for cancer worldwide, and what is it that we can do to reduce those risks. We'll then talk about all the current treatment approaches. We've already heard some amazing results from Dr. Slayman about combining two monoclonal antibodies that could potentially cure breast cancer, or some types of breast cancer. We'll try to define why there has been a decrease in the incidence and mortality, rather mortality of cancer, not necessarily the incidence, but why there's been a decrease in cancer mortality, specifically in the United States over the past decade, and then the role of integrated therapies, combining the best of Eastern medicine and Western medicine, which is the challenge of trying to totally get rid of this burden of cancer worldwide. When I was president of the American Cancer Society in 1995 and 1996, we took a bold step in setting challenge goals. We didn't say that this was going to happen, but we set our goals so that we could then look at our strategy to try to resource with money the areas that could best achieve these goals. So we set the challenge goals, and in each one of these, integrative medicine plays a very important role. We set a goal of 50% reduction in the age-adjusted cancer mortality rate by the year 2015, a 25% reduction in the cancer incidence rates by the year 2015, and most importantly, to challenge ourselves to have measurable improvement in the quality of life, the physical, the psychological, the social, and the spiritual quality of life from the time of diagnosis and for the balance of life of all cancer survivors. This was a very difficult challenge goal, and we've spent the past decade trying to define it more specifically. And again, this is where traditional Chinese medicine and integrative medicine play a very significant role. Well, what about the incidence? This is in the United States, the annual age-adjusted cancer incidence for males, females, and this is total incidence, males here and females here, since 1975 through 2005. Despite our computer age and quick retrieval of data, we remain at least 2 years behind in having verified data for 2006 and 2007. This was the most recently accrued data up to 2005. This is published in the Cancer Journal, CA Cancer Journal of 2008, and does this at American Cancer Society together with the National Cancer Institute, and does this, and the CDC, the Center for Disease Control, each year will publish these results. Notice the increase in trend for all cancers, male, female, and female here. We notice also the mortality rates since 1975. And as you can see, there was a gradual increase up till about 1991, 1992. And then there has been a decline in mortality from all cancers. This should be all cancers. This is the male and this is the female. So there has been a decline in the mortality of cancer. The gradual increase, you can see that there's a big peak. And if you haven't questioned that already, you should. Why did that happen? That was the peak incidence due to the new screening test for prostate cancer using the prostate-specific antigen. So now let's look at some more specific cancers. In the men, we can see that big, huge spike going up here in 1990.